Hi, my name's Alexis Sutton. I was in the Associate Degree Nursing program at Blackhawk. I graduated May 2020, and now I work at Genesis Medical Center in Silvis as a registered nurse in the intensive care unit, also called the ICU. My job consists of continuously monitoring vital signs and trends if they're improving or declining, assessing signs and symptoms of my patient's illness, administering medications and watching for expected reactions or adverse reactions, collaborating with physicians, pharmacists, dietitians, respiratory therapists, and other hospital team members to provide best care possible, regularly evaluating my patient's plan of care to ensure it's appropriate for them, and focusing not only on physical needs, but also making sure spiritual, mental, and cultural needs are met. Some special duties of an ICU nurse include responding to all code blues, which is when someone's heart stops, in the hospital, and performing CPR and giving medications to start their heart again, and administering high-risk medications that require extremely close monitoring of the patient's reaction, such as if someone's blood pressure or heart rate drops really low out of nowhere, I'm allowed to administer certain medications to raise it quickly. Good things about my job would be when my patients and their family thank me for my care, when I'm able to educate my patient with a new diagnosis on how to take care of themselves at home, taking time to talk to my patient and their family about what their concerns are and what I can do to help, and seeing patients I've taken care of for multiple shifts go home feeling better. For example, we had a patient in our unit for 40 days, and watching him go through intense treatment, then being able to walk out of the hospital to go home was an amazing feeling. Some bad things about my job would be seeing patients refuse treatment even though it would help them, watching someone's health decline and sometimes ends in death, especially in the ICU, feeling like you could have done more in a situation, and watching patients lose hope. With COVID restrictions, COVID patients aren't allowed visitors, so it has been hard watching patients sit in the hospital by themselves. It's easier to lose hope when you don't have a support system right by your side. Sometimes the nurse is the only person that they have there. Working in the hospital setting can be really intense and fast-paced, but the rewarding feeling of taking care of people during the hardest times makes everything worth it. Education and training requirements include an associate degree in nursing, CPR certification, and a passing score in the state NCLEX nursing exam.